It is a first for Kenya and the East African region. That enough would be reason for the brains behind the Center for Epidemiological Modelling and Analysis, CEMA, to be proud. But the needle has moved further. The Health Ministry, and indeed the rest of the government, is now digging into what comes out of here and going ahead to make policy decisions.
For some of the advisories we have listened to, given by the president, they have almost been word to word what came out of the consensus messages that we got as researchers working, carefully thinking about the pandemic and how best to control it.
We realize we have to package our work in a way that is actually influencing policy, influencing programs, and influencing products.
This is, however, not how the story began. It started with 3 experts noticing that a dearth in data on health in the country meant decisions made on COVID-19 pandemic were from a point of near guesswork. They decided to act.
When it first started, we're using data from the West, But as time goes on, you realize that your own population has characteristics that are unique, and you cannot necessarily pick data from other places and use for your population. So we start to look for data from the local context and analyze that so that it can inform of the measures that need to be taken, measures that need to be put in place in order to control infectious disease.
So CEMA is inspired by great institutions that have done this kind of thing before. So I think in Africa you can think of the South African Center for Epidemiological Modelling and Analysis based at Stellenbosch University, which brings together experts of different disciplines, from mathematicians to epidemiologists, to tackle big issues around public health.
While Africa may have been spared the wrath of COVID-19 that was witnessed in the West at the start of the pandemic, the World Health Organization has warned that most countries are now in the third wave or at risk of entering the third wave. With institutions like CEMA, the Kenyan government has managed to make quick, informed decisions that, in the opinions of these experts, have not only saved lives, but the fragile healthcare infrastructure from caving under the weight of a high infection rate.
Looking at what do we project and how do we change it? If people wore masks, how would that change? If we stopped public gatherings, would that change what we would see? If we restricted movement, for example, how would that change the spread of disease? So it's been around crafting appropriate advisories to inform the response in the country.
A report by the Mo Ibrahim Foundation indicates that Africa needs more data to improve its response to health crises like the current one. While CEMA started off with COVID-19, the experts soon realized the potential of the center.
Data is really critical so that our decisions, our measures are all evidence-based and informed by our local population. And this is something that definitely should be replicated in many other countries.
We realized, mid last year, when we started seeing gender-based violence, we started seeing maternal deaths and increasing them. We started seeing reduced vaccination for children. We realized that we cannot just focus on COVID. We have to get the government to start working on this other thing, because more people are going to die from HIV, people are not going to take their medicine other than COVID.
Now the center is up and running. Its success has inspired the founders to think of reaching out to neighbors with the aim of helping build expertise on health analytics.
So as we have, fellowships that we are offering now from Southern Sudan, from South Sudan, from Ethiopia, from Sudan, from Somalia, from Tanzania.
The center has big dreams.
Our vision is to be like John Hopkins from the US, London School in the UK, to be able to provide this kind of capability. We don't need an outsider. We have the capacity here in the country.
But funding remains a challenge. The initial funds to set up CEMA came from the Bill and Melinda Gates Foundation.
I think it's paramount for governments, to make sure that they can have domestic funding for this kind of thing. For ourselves, we hope that we can partner with the government of Kenya or even the African Union. We can partner with anyone who is really keen or whose mission is to improve the health of the world, and we want to do that in Africa.
For now, they bravely trudge on, one data set, one demographic at a time. One of the barriers to providing proper healthcare in Africa is lack of data. Now, with portals like this one by CEMA, the continent is able to make informed decisions, and not just informed decisions, but also to inform policy. based on science.